Using your own tissue is also known as autologous reconstruction. There are several options to use your own tissue to reconstruct your breast. Traditional techniques include the latissimus flap, where you're taking skin, fat, and muscle from your back and rotating it forward to the chest wall. Generally, latissimus flap reconstruction requires an implant. The other traditional option is using your lower abdominal tissue with a procedure called a tram flap, where you're taking the excess skin and fat in your lower belly, and you're taking the skin, fat, and its underlying muscle, and you're tunneling the skin, fat, and muscle up to the chest wall from your lower belly to rebuild and restore your breast. The newer state-of-the-art technique that we perform on a weekly basis is called the DIEP flap procedure, or the deep flap procedure. Now, this deep flap procedure is a state-of-the-art procedure in that it's like the tram flap in that it harvests and takes the excess skin and fat that would be normally thrown away in a cosmetic tummy tuck and uses that excess skin and fat to restore your breast. But the deep flap is very different than its predecessor, the tram flap, in that the deep flap does not need to take your abdominal wall muscles. In other words, the deep flap is an abdominal wall muscle or a muscle sparing procedure. The deep flap, we take only what we need, which is the excess skin and fat. In these autologous procedures using the lower abdominal tissue, the nice fringe benefit advantage is the way we close up the donor site, you get a tummy tuck out of that procedure. Autologous reconstruction, the advantage of autologous reconstruction such as a deep flap is that you will not need an implant. It's your own tissue, it provides a nice, soft, supple breast, and your tissue is yours to keep for life. There is no concerns regarding rejection, scar tissue formation, or rupture because it's your own natural tissue.